What causes secondary infections in eczema rashes? Have you ever wondered why some eczema rashes seem to get worse and even become infected? Let's break down what causes these secondary infections in eczema rashes. Eczema is a condition that affects the skin, leading to dryness, redness, and itchiness. One of the main issues with eczema is that it damages the skin barrier. This barrier usually protects our skin from harmful microbes like bacteria, viruses, and fungi. When this barrier is compromised, it becomes easier for these microbes to invade the skin. Genetic factors play a role in this. For example, mutations in the filaggrin gene can impair the skin's ability to repair itself. This results in skin that is dry and cracked, making it more susceptible to infections. The most common bacteria that cause secondary infections in eczema is Staphylococcus aureus. This bacterium can be found on the skin of many people with eczema. When the skin is inflamed and broken, it provides a perfect entry point for Staphylococcus aureus to invade. This bacteria can produce toxins that worsen the inflammation and further break down the skin barrier. When an infection occurs, you might notice increased redness, itchiness, and even oozing or crusting on the skin. Sometimes there can be a yellowish discharge. Other bacteria, like Streptococcus pyogenes, can also cause infections in eczema, leading to more complications. Viral infections can also be a concern. For instance, the herpes simplex virus can cause a serious condition known as eczema herpeticum. This condition is characterized by painful blisters and systemic symptoms like fever. Fungal infections, such as those caused by candida or ringworm, can also affect the skin affected by eczema, making it hard to tell apart from eczema itself. The risk of secondary infections increases when eczema skin is scratched frequently. Scratching damages the skin barrier even more, allowing microbes to penetrate deeper into the skin. Weeping eczema, where the skin oozes fluid, is especially prone to infections. To prevent these secondary infections, it is important to keep the skin well hydrated and to avoid irritants. Managing eczema flares quickly can also help. If an infection does occur, treatment may involve topical or oral antibiotics for bacterial infections, antiviral medications for viral infections, or antifungal treatments for fungal infections. Taking care of your skin and addressing infections promptly is essential to protect your skin and reduce complications related to eczema. Understanding these factors can help you manage eczema more effectively and keep your skin healthy.